If you are trying to make sense of the latest news regarding weight loss medications in Medicare, you are not alone. As of May 2026, there is a massive shift happening in how the American healthcare system handles GLP-1 drugs for seniors. For years, medications like Wegovy, Zepbound, and various formulations of Ozempic were largely out of reach for many retirees because Medicare was legally barred from covering drugs used primarily for weight loss. But that landscape is officially changing this year. If you or an aging parent have been waiting for these treatments to become affordable, the next few weeks are critical for your planning. There is a significant update from the Centers for Medicare and Medicaid Services that families need to know about right now. A temporary program called the Medicare GLP-1 Bridge is being extended through the end of 2027. This is a short-term solution designed to provide immediate relief while the government figures out a more permanent way to integrate these costly medications into the standard Part D benefit. This extension is a major win for families who were worried that the pilot program scheduled for this year would end too quickly. However, it also comes with some complicated news about the delay of a permanent model, which means the rules for 2026 are quite specific. To understand why this matters right now, we have to look at the cost of these medications without coverage. Currently, a 30-day supply of these specialty drugs can easily cost over $1,000 out of pocket. For a senior on a fixed income, that is simply impossible. But under the new Medicare GLP-1 Bridge demonstration starting on July 1st, 2026, eligible beneficiaries enrolled in Part D will have access to weight reduction medications for a flat copayment of only $50 per month. This applies to several popular formulations, including all versions of Foundayo and Wegovy, as well as the quick-pen formulation of Zepbound. This change is happening because of a massive rise in demand and a growing recognition that treating obesity is a critical part of managing senior health. Between 2019 and 2024, gross spending on these drugs in Medicare and Medicaid skyrocketed from less than $1 billion to over $27 billion. The government realized that waiting for a permanent law change was taking too long, so they used their demonstration authority to create this bridge program. It is essentially a way to test how these drugs affect the overall health of seniors while providing immediate financial help. However, there is a bit of a paperwork trap that families need to watch out for in May and June. While the Medicare GLP-1 Bridge is expanding, a separate permanent model known as the balance model has been indefinitely delayed for Medicare Part D. This is a bit of jargon that basically means the long-term permanent coverage we were hoping for isn't coming as fast as we thought. Instead, we are relying on this temporary bridge through 2027. This makes it even more important to understand the current eligibility rules, because if you miss the requirements for the bridge program, you might be stuck waiting even longer for affordable access. If you are helping a parent navigate this, the first thing to check is their current Part D enrollment. The $50 copay is specifically for those in Part D plans who meet the medical eligibility criteria. Unlike some other Medicare benefits that are automatic, your doctor will likely need to provide specific documentation to show the medication is medically necessary. This isn't just about losing a few pounds for a vacation. It is about treating a chronic health condition that impacts your overall well-being. For Medicaid, the news is even more immediate. Many state Medicaid agencies are launching their participation in the balance model right now, in May 2026. If your parent is duly eligible for both Medicare and Medicaid, they may have even more options for coverage starting this month. Let's look at a realistic family scenario to see how this works in real life. Imagine a senior named Mary who has struggled with her weight and high blood pressure for years. Her doctor recommended Wegovy in 2025, but her Medicare Advantage plan wouldn't cover it because it was classified as a weight loss drug. Mary was looking at a bill of $1,200 a month, so she had to decline the treatment. Under the new July 1st rules, Mary's doctor can submit her information through the GLP-1 Bridge program. Once approved, Mary will only pay $50 a month at the pharmacy starting this summer. Over the course of a year, this one change saves Mary over $13,000 in out-of-pocket costs. But there is a catch that no one really tells seniors. Not every pharmacy is going to be set up for this program immediately on July 1st. The way pharmacies are reimbursed for these drugs is complicated. Medicare will pay the pharmacy at a rate no lower than the wholesale acquisition cost minus your $50 copay. And then the drug manufacturers have to pay the government back for the difference between that price and a negotiated net price. Because the money is moving in several directions at once, you should call your pharmacy in June to ask if they are participating in the Medicare GLP-1 Bridge program. If they aren't, you may need to find a different pharmacy before your July refill. Another factor to consider is the Part D out-of-pocket cap for 2026. This year, the maximum a senior will pay for all their covered prescriptions is $2,100. This is a $100 increase from last year, but it is still a huge protection compared to previous years when costs could reach $8,000 or $9,000. The $50 copays for these weight loss drugs will count toward that $2,100 limit. Once you hit that cap, your plan will pay for 100% of your covered medications for the rest of the year. This means if you are taking several expensive medications for heart disease or diabetes along with your weight loss drug, you might reach that $2,100 ceiling by late summer, making your prescriptions virtually free for the remainder of 2026. This is exactly the kind of rule families find out the hard way if they don't plan ahead. If you wait until you are standing at the pharmacy counter in July to ask about this, you might find out that your specific plan hasn't updated its formulary yet, or that your doctor hasn't submitted the right paperwork. The month of May is the time to have that conversation with your healthcare provider. Ask them specifically about the Medicare GLP-1 Bridge and whether you meet the clinical criteria for the $50 copay. You want to have that authorization in the system before the program officially rolls out. For those in Medicaid, the situation varies by state. As of early 2026, only about 13 states were providing broad coverage for these medications, which was actually a decrease from previous years due to state budget challenges. However, with the new federal model launching this month on a rolling basis, more states are expected to join back in. If you live in a state like California or Illinois, where Medicaid eligibility rules were recently updated, you should check your state's Medicaid portal this month to see if weight loss coverage has been added to your benefits package. We also have to talk about the fraud risks associated with these new drug rules. Whenever the government announces a new high-value benefit like $50 weight loss drugs, scammers are right behind them. In May 2026, we are seeing a rise in phone calls and emails from people claiming to be from Medicare, offering to sign you up for the GLP-1 Bridge program. They might ask for your Medicare number or your bank account information to verify your eligibility. Do not give your number to anyone who calls you out of the blue. Medicare will never call you to sign you up for a drug program over the phone. Your eligibility is handled between your doctor, your insurance plan, and the pharmacy. If someone tells you that you have to pay a registration fee to get the $50 price, hang up immediately. It is a scam. To stay safe, build a simple habit of verifying any new health benefit through an official source. You can use the Medicare Plan Finder tool, though you should be careful there too. Earlier this year, CMS warned that some of the provider directory data in the Plan Finder might be incorrect. If you choose a plan based on a doctor being listed as in-network for these new medications, and then find out the directory was wrong, there is a new special enrollment period available in 2026 that allows you to change plans. This is a very important protection for families who are trying to make sure they can keep their doctors while accessing these new drug benefits. If you are an adult child helping a parent through this, here are the steps to take in the next 30 days. First, verify the medications they are currently taking and check if any of them are on the newly negotiated price list. 10 major medications, including drugs for heart failure and blood thinners like Eliquis, now have much lower negotiated prices that took effect in January. Second, schedule a medication review appointment with their doctor for late May or June. Bring up the GLP-1 Bridge program and the $50 copay. Third, call their Part D plan and ask specifically how they are implementing the July 1st Bridge extension. Navigating these changes can feel like a full-time job, but the potential savings are worth the effort. The system is finally moving toward covering these treatments, but it is doing so through temporary programs and rolling implementations. This means the burden of being informed falls on the families. If you take one thing from this, it is that the $50 copay starts on July 1st, but the preparation starts now. Don't wait for a crisis or a high bill to start asking these questions. Tell me in the comments, have you been waiting for weight loss drugs to become affordable under Medicare? What has your doctor told you about the new Bridge program so far? Hearing your real-world experiences helps everyone in this community understand how these rules are actually working on the ground. Protect the paperwork, verify the details, and always ask one better question before the next decision. I will see you in the next guide.